Your self-talk plays an important role in how you're responding or reacting to OCD. So self-talk is obviously thoughts, and thoughts could be either verbal in words or non-verbal, which is images, feelings, sounds, taste, smells, five senses. And also it can be either conscious or non-conscious. So the most devious kind of self-talk, and that goes hand in hand with anxiety, that's and shame, that are part and parcel of OCD, is non-verbal and unconscious thinking, where you're not aware of what you're thinking. It's non-verbal, and there are spikes of anxiety coming from obsessive thinking, and then leading the person through that urge to minimize that anxiety towards compulsive action. And so all of this, by the time OCD is ingrained, it happens on that kind of unconscious basis, where it's just like a knee-jerk reaction between the obsession and compulsive action. And so, of course, speaking about self-talk, we want to bring it from that non-verbal and unconscious territory into something that's verbal and conscious. So in this way, it's being able to look at your thoughts and to say, okay, so I'm thinking that's okay, so this I need to take this a compulsive action based on this obsession. So that's obviously how you're framing it for yourself. But most important, that again, if you look at what's going on the inside, that's step number one. Then and so externalizing it in a way. So externalizing it or verbalizing it, step number one. Then second is observing it, and observing it. Ideally, you want to do it not just completely without any emotion, but ideally you want to do it with kindness. So that's what goes from simple observation into compassionate and kind observation with yourself. Like as if you're doing it with a therapist, or as if you're doing it with somebody who is kind to you, like a good parent to your friends, somebody who can hold the space for you to be there with you, to hold your hands and to support you with a kind word. So, but be like that to yourself, that self-compassion element. And then once you're observing it, once it's conscious, once it's verbal, once you're being kind toward yourself. And by the way, being kind toward yourself, it can be also quite structured. You can do it in 3 simple steps, and I'll go further into it in different video. But step number 1 is just acknowledge that I'm suffering right now. Step number 2 is to know that you're not the only one like that, and just say it's like, okay, yeah, there are other people who are suffering from OCD right now as well. So this is common humanity, and that's something that comes from self-compassion. I didn't invent it. And then finally, the third step is that intention of how can I be kinder with myself. What can I do that's nourishing? What do I need right now? That's kind orientation towards yourself. And then from this step, further in self-talk, this is where you can go into what you know, either somatic techniques where you can breathe and do either fast breathing, to step away from thinking, or the slower breathing, to bring down your level of sympathetic activation. Or you can do cognitive tools. So you can reframe your own thinking. You can look at it from a different angle. You can take a different perceptual position. You can ask yourself questions like, okay, so if I didn't have OCD, so what would I do? What would I think now instead? And so that gives you a lot of leverage. And then once you're feeling better, once you're thinking clearer, you can even start expanding on the kind of moments that you would like to have more of. For example, if you're seeking for inner peace, then you can find the space inside where it's already peaceful, or remember the time then when you were peaceful, and start almost like rampaging and feeling your way, describing your way into feeling more of that, or acknowledging and appreciating the peace wherever you have it in your life, and in doing so, is again building up and expanding that peaceful state. So, and all of that you're doing through becoming aware and conscious of your self-talk, and then guiding it in a purposeful way towards your benefit, instead of self-talk just being there and those loops of rumination just kind of that sucks the person deeper and deeper into the pit of OCD.